Good evening, Miss Simmons. How are you?
I'm doing well, and yourself?
Good, thank you. Okay, so today's treatment, I know you've been here with me before. As you remember, my name is Alex. I'm a student occupational therapist with the University of St. Augustine. Today, we're going to go over some medication management techniques, okay? I know that recently you were diagnosed with postpartum depression and your doctor prescribed you a couple different medications, and you're also on another medication right now for hypothyroidism, and he was okay with you taking those together. So I know you were having some trouble remembering trying to take them, but that's what today is going to go over. I have a couple ideas, couple techniques to help work that into a good routine for you, all right? What was your biggest difficulty? What's one of the biggest problems you're having remembering to take these pills? What is the biggest obstacle you find that you're having?
Just staying on track and having a set routine and schedule. It's just normally I just can't seem to get up, unmotivated, and so wait till the last minute and then rushing to get all the kids ready and get them out and get them to school and whatnot, and then taking care of the baby, and it's just...
So you're putting yourself last.
Yeah.
Right.
Yeah.
So that's something I think we can easily, it sounds easier said than done, of course, but that's something we could easily try to pick apart maybe a little bit of your routine during the day and incorporate some good ideas. But first, let's look at these medications real quick. You are on the Synthroid, I believe it looks like right here, for your hypothyroidism, correct?
Mm-hmm.
Okay. Do you have any basic questions about those? You've been taking that for a little while, right?
Yeah.
Side effects with those are pretty common to the Lexapro. I believe you're on the generic for the Lexapro for the current postpartum. Both of those side effects, dizziness, dry mouth, a lot of them say you could experience some joint pain, just that general achiness, changes in your menstrual cycle, changes in your sex drive, and changes in your sleep cycle. Some people find that at first when they first start taking both of these that they're really sleepy, but then some people find that it keeps them awake. So none of those are too extreme, but if you find you're experiencing like rapid heartbeat or irregular heartbeat or hot flashes or sweating, maybe just call your doctor. If it feels funny, just call your doctor. A really important note for these meds, the Lexapro has to be taken at the same time every day. Now, the Synthroid for your hypothyroidism should be taken at the same time every day, but the most important thing about that is it needs to be taken 30 minutes before a meal. So they suggest taking it in the morning. So I think a good idea for you maybe is take them both at the same time because they are allowed to be taken together. There's no contraindications or no warnings that you can't take them with each other. Since the Lexapro needs to be taken at the same time every day and the Synthroid has to be taken before a meal, maybe the first step is we decide to take them together so that you knock both of them out at the same time. And since the Synthroid needs to be taken 30 minutes before a meal, I mean, do you generally eat breakfast?
It all depends. It depends on how late I stay in bed and getting the kids ready for school and getting them out. Sometimes I'm munching while they're eating or
picking at their breakfast. Yeah. So maybe we just start with that. Start in the morning, taking both of those together at the same time. I know it's kind of hard to, especially as a mom, to know when you're going to eat 30 minutes after you take something, but maybe that's the first thing we do. We can talk about taking it in the mornings. Second thing is, I know sometimes we say we're going to take it in the mornings, but I know for me, for instance, if it's not there in front of me, I'm not going to remember to do something. So first thing in the morning, I know you said you've got kids, so do you go to the bathroom? Do you get up and start coffee? Like what's the first place you think you will see every morning? Like the bathroom sink, the kitchen sink, the baby's changing table? I don't want you to put your meds on the baby's changing table, but
it's hard to say. Obviously, it'd be nice to probably wake up and go to the bathroom every single day before everything, but you don't always get to do that. Right. So eventually I always make it there.
Yeah. So maybe we do that. Maybe we start with, let's think, first your routine, get up, go to the bathroom, use the restroom real quick. I mean, you kind of have to do that. You can't be dancing around with the kids. Well, I have a pill bottle here just as an example. It's mine. But maybe as a visual cue, you have both of your medications out in front of you. Put them next to the sink, next to your toothbrush, or right there, even if like you're sitting on the toilet, somewhere that It's right in front of you. You can see in the morning, and you pass by and you notice. And so that way they're right there, you know, take them, okay, it's morning. And you'll start getting that in your head and start working that into your routine. And another good thing, I know sometimes it's hard to remember if you've actually taken it. You kind of get, once you do start getting that routine, if you remember to take it. So I think a really good idea is when you've taken your medication, it's kind of hard, these are the only pill bottles I have. It's kind of hard to show this example, but when you've taken your medication, maybe in the morning you've taken it, turn it upside down so you know you've already taken it, and place it upside down on the table. And then place it, wasn't in view, sorry. Place it upside down, okay? And I kind of wrote a sticky note here for everyone to see. So it's just kind of like an example. And I wrote, drew a picture, please don't judge my art. That's not what I'm in school for. Face down equals taken in the morning, face up equals taken at PM. But you could do something similar to this, means taken, hasn't taken. But since we're going to start working with, our first idea would be, let's take them all together at the same time.
Yeah.
And that way then, you know, you've got them out in front of you at the sink. So each morning, you know, let's take them both together. They're both done, out of the way. Is that something you think, does it sound easy enough? I mean, you've got juggling so many balls at so many times, but I think
that's probably a good start.
It's a good start. It's easy. It's right there in front of you, next to your toothbrush or face wash, something that you know you will do every day that you'll see. And I know that's the best way that a lot of people can do it. It's right there in front of them. Now, another suggestion may be, do you use your phone a lot? I know that's a crazy question, especially this day and age, but with 3 kids and your husband and everything, I'm sure you do. Now, there's a lot of good apps out there that do medication reminders, and they're a lot free. I know one of my favorite is called Med Coach, M-E-D, Coach, just one word. Like I said, it's free. You put all your medication information in there, your pharmacist, your doctors, and then there's alarms on there to tell. I mean, you can get really fancy with it. It sounds really intimidating, but it's really not, and I would love to help you set that up. There's also other apps. If you would just go to the iTunes Play Store, the Google Play Store, whatever kind of phone you have, and we can look up medication reminders or medication alerts or medication alarms. A lot of those come up. So I know MedCoach, that's one of my favorite ones to use. You can align it with all of your doctor's information. That also, the pharmacy information, phone numbers, and then it'll set off monthly reminders when you need refills, daily reminders of what medication, how much you need to take. It's very detailed. It's kind of like your own little personal pharmacist in your pocket. So that's something I think when we get down the road, if you're adding any more medications, or you can even add different people to that one. Once you start feeling better and you're starting to get a little more routine and you don't think you need as much of that visual cue in front of you, that'd be a good idea to use that too. But that app kind of reminds me, app is also a good idea to use as well if you're ever out of town, because, you know, especially with your husband being deployed or something, it's really good to keep track of you, and even it's a good idea for your kids, but for you too, especially with new meds coming on, with you having new medications, it's really hard just to keep track of just life, everything. You have to keep track of all your kids. So, and I have my parents do this too. Any note section in your phone, just put your new prescription number, and sometimes I put my milligrams, because I know when I fill out information at the doctor's office, I don't always remember how many milligrams I take. And I would put my doctor's name and my doctor's phone number and the pharmacy number in my phone, and any contact information that's related to that. So if there is an emergency from a natural disaster or a loved one emergency and you had to go out of town, you would be able to have that information accessible to you. Say if you forgot your meds, or if you needed to get some more, you could call your doctor and they could call them in. And I would always suggest, I had to learn this the hard way, using a pharmacy location that has stores or locations nationwide, like a CVS, Target, Walgreens. And a lot of the CVS and Walgreens are open 24 hours. So again, if there is an emergency, you can contact them. They usually have your name on file because it's a nationwide store. So they have all the information. So I think that is a good thing that we could potentially go over maybe, I don't want to give you homework, but that's
Yeah.
a good homework you could maybe work on just as you know, you don't have a lot of free time, but when you start feeling a little better and you're messing with your phone, maybe just add in these first 2 medications. Okay? One other thing I would recommend, and if it's up to you, I think maybe it's something you could put out on your bathroom counter as well. And I'm sure you've seen them everywhere, but those pill organizers, have you seen them? They have like the Monday, Tuesday. Now they're getting really fancy with them. They have locks on them now. They have alarms. They have like a dial. For, you know, they get super fancy for a lot of the elderly people that can't open them too well too. And they have the volume that alerts them. But ones I like for my patients, I think that are really good. They have 2 rows of Monday through Sunday, but they have Monday through Sunday AM and Monday through Sunday PM. So I think that'd be really good for you too, because eventually these medications, you do work your way up in milligrams for them. You start at a certain low dose and you'll increase with them, because it is about balancing the hormones back, both of these medications, the Synthroid and the Lexapro. So eventually you don't want to plateau, you do want to help regulate out. So when you do go up, you may need to spread out. Your doctor may recommend you take 1 in the morning, 1 at night. So that pill organizer would be great, because then you know, oh, I've already taken it today. But the most important thing would be to remember to refill it at the end of the week. But these are all really easy things we could work on. Like I said, I don't really want to give you too much homework, but I think this is something, I mean, you're a mom. This is something you could easily go home and just checklist. Like when you get home tonight, take your pill bottles out from where you're keeping them now and just put them right there by your bathroom sink today. Yeah. Does that sound like something we could do?
Probably, yeah.
Do you have any questions for me for this treatment today?
No.
All right, great. I think that's something we could go over, and I think the next visit, I'll help you. If you want me to, I'm going to help call. If you want to bring in one of your medications, if you see this phone number at the bottom right here, because like I said, this is mine. You call when you get a refill on yours. You can set up for automatic refill. Do you have yours set up on automatic refill yet?
Probably not.
Probably not. If that's something you would like me to help you do, I definitely think we could do that with most of them. Yeah. And then we can go over some more information on those medications and set up some good calendar times for those. Sound good?
Yeah.
All right. Thanks, Leslie.
Thank you.